You're listening to Fire Ecology Chats, a podcast series by the Association for Fire Ecology.
Hello, everyone. My name is Bob Keane. I'm the editor-in-chief of the internationally renowned Journal of Fire Ecology. I will soon be yielding my position to Jeff Kane. He is the new incoming editor-in-chief, and we are very excited to have him. Fire Ecology is an international journal that publishes science about fire and fire ecology. It is run by AFI and published by Springer, and we're very excited today to have a really important guest here. First of all, the reason the guest is important is because social science people that study fire have adopted Fire Ecology as their go-to journal for publishing their works. And today we're going to do the first podcast on a social issue in fire ecology. And we're very excited to have Alissa Cordner here to talk about it. Alissa, can you introduce yourself?
Yeah, thank you, Dr. Keane. It's great to be here. My name is Alissa Cordner. I am a professor of sociology at Whitman College, which is in Eastern Washington State in the U.S. And I have been studying wildland fire risk questions for about 10 years. I also volunteer with our county fire department as a volunteer wildland firefighter, although today I'll just be talking about my academic research, which is mostly with federal wildland firefighters.
Well, welcome aboard the Fire Ecology train. Really appreciate your time to talk today. And we're going to be talking about the paper Environmental Health Hazards in Wildland Firefighting, a Qualitative Analysis. Can you give us a little sneak peek of the paper and tell us a little about the background?
Yeah, happy to. I would argue that for anybody interested in wildland fire and for anybody who's interested in the social aspects of fire ecology, that firefighter health and safety should be right at the top of your priorities. And it's no surprise there's been increasing attention to firefighter health and some attention to increasing exposures and concern about what firefighters might be exposed to, especially around things like smoke. And watching that increasing attention coming out of the media, coming out of federal agencies, I realized that many of the hazards that I had actually experienced in my research or that I'd heard about from wildland firefighters weren't being mentioned. There was a lot of attention to smoke, which of course is a really important issue, but they weren't being discussed in the media. And in large part, there isn't enough attention to them among the agencies or enough attention in terms of how firefighters are training and the protections that they're able to take on the job. Now, the things that I write about in the paper are not going to come as a surprise to folks who are actually working on the ground. So firefighters themselves, fire managers who have long careers, I would imagine that they would read through this paper and think, yep, well, I already knew that. Why did you have to write a whole paper? Why did you have to do all this research and write this paper about things that, of course, I experienced these on the job. But if you look beyond just the practitioner sphere, I would argue that they really are under-acknowledged, that there isn't enough attention to the really broad range of environmental health hazards that firefighters are experiencing. I'm an environmental sociologist, so I study how people interact with their natural environments. And so I had been using qualitative methods of interviews and ethnographic research, which is participatory research, to study risk questions. And that's what led me to this.
I agree with all of your points. That's great. Thank you for doing this wonderful study. As I read the paper, I was amazed at some of the methods that I really hadn't seen before. Can you tell the people about the specialty of these methods?
Yes, for fire ecology readers, there's a lot less ethnography in your pages than there is of other methods for sure. As I said, an environmental sociologist, and a lot of my research is qualitative. So drawing on in-depth interviews and observations, working side by side with firefighters. So starting in 2015, I was able to connect with Federal Fire Management Organization and essentially work alongside their firefighters, filling in on engines or hand crews when they had an open seat, attending meetings, shadowing incident management team. And so that's the observational research that informs the paper. And then I've also done semi-structured interviews with firefighters, fire managers, and other firefighter experts, or experts around wildland fire more broadly conceived. And I think these methods are really useful for a paper like this, where the goal is to identify the broad range of environmental health hazards that firefighters are exposed to. We know from other areas of environmental health research that more open-ended and qualitative methods can be really useful in an understudied area when you're not just trying to measure, say, how frequently someone might be exposed to a particular hazard or at what scale, but you're actually trying to figure out, well, what are the things I should even be paying attention to? And so for that more exploratory question, qualitative methods make a lot of sense.
Yeah, they sure did. Thanks for that. It was really cool how you did it. So I know a lot of people are very excited about the findings. Can you give us a little sneak peek of the findings?
So what I did was I drew on these multiple years of ethnographic participatory research with wildland firefighters alongside these interviews that I had done. And I first talked through the ways in which firefighters themselves, they're really aware of the types of hazards that are widely acknowledged by firefighting agencies or by land management agencies, the types of things that are trained into the work of practicing firefighters. They are aware of those risks. They're aware of their exposures to things like smoke. They're aware of concerns around, we call the human factors of firefighting health and safety, things like levels of stress that you might experience on the job, or getting enough sleep, or the importance of nutritious food and a healthy diet. Firefighters are aware of those, and they talk about them thoughtfully and in a really nuanced way. But then additionally, I identified two broad categories of environmental health hazards that receive a lot less attention. So the first are hazards that are really routine, but are generally unacknowledged. One of those big hazards that has received a little bit of attention very recently, back just in February of this year, has been the chemicals that firefighters might be exposed to through their PPE, their personal protective equipment. The federal firefighters that I have worked the most with, they often will wear their Nomex pants pretty much all day. Maybe you show up to the compound, you do your PT or your exercise, and you go to briefing, not in your greens. But for the rest of the day, through patrols, the full duration of your shift, you're wearing your greens. And there is concern about the coatings that might be applied to those fabrics and how people might be exposed. And so there's been some testing of Nomex PPE for wildland firefighters that has found in some textiles high levels of PFAS, the forever chemicals, per and polyfluoroalkyl substances. So we know that some PPE has high levels of PFAS. Some appears to not have high levels of PFAS, but I was also able to find some testing that found high levels of bromine, which the researcher who did the testing interpreted as likely high applications of brominated flame retardants to that textile itself. And brominated flame retardants are linked up with a lot of potential health consequences, including multiple types of cancers and impacts on reproductive health. You might think, okay, you're wearing your PPE when you're just engaged in fire suppression, but like I said, for a lot of firefighters, they're actually wearing them for the entirety of their shift or for virtually all of their shift. Because of the nature of wildland firefighting, you are out in the field, you are likely eating out in the field. You might, and I've done this on many occasions, you actually put your food on your lap because you don't have a desk, you don't have a table to eat at, so you're actually eating right off of your Nomex pants. And so there's a lot of concern about potential dermal exposure and also ingestion exposure if their food or their hands are coming into contact with chemicals in their gear, and then they're consuming that food. So that's an example of one of these hazards that I argue are routine, but largely unacknowledged. And there's a bunch more in the paper as well. And then the final category of hazards that I identify are hazards that are specific to the incident or location that you might be fighting fire at. So one really concrete example is that there are an unknown number of abandoned mining sites around the country, especially in the western half of the United States. This is true globally as well. And unknown number, but in the hundreds of thousands. So mining sites in some parts of the country are really ubiquitous. Sometimes they're mapped very well, but sometimes they're not. And so that can pose a sort of geographical hazard for firefighters. Another example that honestly firefighters themselves loved to talk about when I was doing my research is the hazardous food that people might be given on an extended incident. So if you're working out of your home base, you're probably providing your own food. But if you're a firefighter assigned to an extended incident or to a complex fire, you are given food from the caterer. And there are plenty of caterers out there doing a great job. And there are plenty of caterers that are providing, or in the past have provided, subpar and sometimes dangerous food. One firefighter told me about being offered pastries that had rodent damage on them. There's also the infamous rainbow meat that is sometimes provided by large caterers in your lunch bag. So lots of potential concerns about the quality of the nutrition that firefighters are experiencing. And again, that would fall under this broader category I identified of hazards that might be specific to a particular incident or location.
Yeah, it's very interesting. I've actually seen university students wear those Nomex or greens to their classes, and I'm thinking, wow.
Mm-hmm. Yes.
So how can we use these important findings to make firefighting more safer?
One of the things that I think comes through this research is the hazards that have been worked into the training that firefighters receive. Those hazards are broadly recognized. Firefighters, by and large, are really aware that the smoke that they're inhaling is potentially harmful. Now, do they have enough control over their exposures? No. And are there still risks from smoke exposure? Absolutely. But at least they know that that's a concern, and they can individually to some degree, but also in terms of fire management organization, steps can be taken to reduce exposure. So for example, you can rotate crews out of really smoky assignments more frequently rather than having the same hand crew holding for day after day after day. Maybe you have crews do a half day holding before they get rotated into clean air. The things that fire management agencies have prioritized, firefighters are widely aware of, and that at least creates some potential for change. But a lot of these hazards that I identified have either been completely ignored by agencies, completely ignored by many researchers, or they've received really nominal and relatively isolated attention. So there might be one mention in a training module. For example, if you look at how firing operations are trained, there is a line about how fusees are potentially emitting noxious exhaust. But that's just one line in a larger unit on firing operations. And so if there could be greater attention in training to the hazards that are out there and how you could address those hazards, I think that could really make a difference. But it also calls attention to some of the bigger questions around how firefighters are being asked to engage in potentially hazardous locations and in ways that might put them at greater risk. There are also practical barriers to reducing some exposures. If you're out in the field, it might be really hard or impossible to have high quality hand washing, for example. But there might be a middle ground where you're not able to have, a warm water hand washing station, but maybe you can have some wet wipes and you can really try to clean your hands that way. So there might be some practical interventions, and the more attention there is in training, the more direct acknowledgement of hazards by leadership and by agencies, that might also start to create some useful movement in firefighter culture, which we know is by and large pretty risk tolerant and might be less likely to take on some of these hazards without a larger institutional change.
It's like the safety officers on these firefighting crews need to be a little more creative in the ways they want to keep us safe when we fight fires. Alyssa, I want to really thank you today for this wonderful talk. Thanks for introducing everybody to your paper. And if anybody's interested in this paper, guess what? You can download it for free from our website. That's right. Alyssa's already paid the freight for you to read the paper. You don't have to pay anything. So you get it for free. So go ahead. I will tell you this, that she has left a lot of stuff on the table, and there's a lot more information in this wonderful paper. So please download it, read it, understand it, and get it. And please tune in to the next Fire Ecology Chats.
Thank you for listening to Fire Ecology Chats, a podcast series by the Association for Fire Ecology. If you enjoyed this episode, subscribe to our show and leave us a review. To learn more about fire ecology and support our future work by becoming a member, visit fireecology.org. fireecology.org.